going to go ahead and proceed with your scalp examination today, and of course afterwards we will have a look at your back and do the skin assessment there. But for now, I would like to have a look at the different areas of your scalp that you said you've been experiencing these symptoms. So allow me just a second to go ahead and put my gloves on. Of course, just ensuring the safety of both you and myself. Gloves are a tad big for me, but we will make it work. Okay, now are you in a comfortable position for us to go ahead and proceed? Perfect. Okay, so when you look at your scalp as a whole, I think the first thing I want to do is just do a simple test for temperature variation. So I have a temperature gun or thermometer gun, and I'm just going to be using this to essentially point at various areas of your head, and this is just going to allow me to test for any possible temperature variations. So I'll go ahead and turn that sound off for you. And so far I'm getting an average reading that is within normal limits. But I'm just going to go ahead and test a couple different areas. Perfect, okay. So good news there. Nothing was abnormal as far as your temperature goes. I wasn't seeing any great variance in between the different areas, so that's a good indication that there are no signs of inflammation or external infection, which is great. So we can go ahead and proceed with the next portion of our examination. So what I'm going to do now is just a couple of very simple measurements for symmetry here. So you just go ahead and relax for me. I have a paper tape here that I'll just be using to measure a couple of different things. So starting with the radius here, so about 15 inches ear to ear. Okay. And then I'm going to do ear to ear from the lateral angle as well. So about 14 inches there. Okay. Of course, we will do front to back, and again about 15 inches, which does show some symmetry in your cranium. So that is very good news. Okay. Alright dear, so let's go ahead and move on with some more measurements, and this tool is just simply going to allow me to measure various angles of your head from one side to another, and again just measuring for symmetry. So just go ahead and relax for me. I just want to have a basic look at a few different angles here. Good. Now, of course, this is fairly standard, just checking for certain parameters, making sure nothing is out of the norm or what we would consider not within normal limits. And looks okay. So the last measurement tool that I have is this one here. And this tool is going to allow me to measure different angles of your head essentially. Angles maybe isn't the right word because I'm really measuring kind of circular areas, but just to put it plainly, I am using the markers on my ruler to measure different parts of your cranium, noting where the area lies and noting my midpoint center here and how that lies on your head in comparison to my corner points here. So I am seeing a good amount of symmetry. Nothing here appears to be abnormal as of yet, which is wonderful news. Okay, so my midpoint here, and that's about equal there. Maybe slightly off center, but that's okay. Perfect. And lastly, at the base of your neck here, and to the tip of your forehead. So that is great. Okay. All of those measurements were well within normal limits. So we can go ahead and proceed with the next portion of my examination. And at this point, I think I'm going to go ahead and section off different areas of your scalp in order to gain visualization of the skin so that I can have a look and see some of those things that you were describing to me earlier. So let's go ahead and do that. And why don't we start with this? So just have a little bit of a comb here, and before I begin sectioning off your hair, I do just want to have a very brief look since you already have a small area parted. I'm just going to have a look and see if I can see anything abnormal. So looking for any signs of further infection, any signs of possible infestation. Obviously that's not what you're here for today, but it is a good idea that we go ahead and check. So just having a look at your scalp and hair, looking for any notable abnormalities on the external level. So of course looking for any signs of lice or mites, which I'm not seeing so far, so that is great. Also no indication of any eggs, so that's wonderful. Also looking for any signs of flaking related to dandruff or psoriasis of the scalp. So I'm not seeing any signs of seborrheic dermatitis, which is great news. And of course looking for any signs of excess hair loss, which I'm also not seeing. Does not appear to be any symptoms of acute folliculitis, but of course that's something that we will look for more in depth when we section through your scalp. Let's go ahead and do that now. So I have a comb here, and I'm going to be using the sterilized end to just section off a couple different areas and kind of have a look in a bit of a grid pattern. So you said you were experiencing these symptoms at the top kind of crown area, so let's start by sectioning off a small area here. Okay, so I do see a little bit here about what you were explaining to me, so I can definitely see why you were concerned. Okay. Okay. So, as suspected, the course of treatment that I lined up for you will be appropriate. So, I do see some of the affected area here. Not quite as severe as I was expecting based on your description, but it does appear to be the start of something. So, why don't we go ahead and treat that for you today. So, I'm going to go ahead and start with our treatment, and let's go ahead and apply our solution to our first section. So of course this is going to be slightly cold, and I do apologize for that, but this is just a sodium chloride solution. It's going to allow us to hydrate the follicle of the hair as well as the hair shaft so that it's plumpened essentially and is able to absorb the treatment. So of course we have to moisturize before we can treat. So just using this as my stabilizer essentially, and I'm going to begin by applying just a couple of drops. So 1, 2, 3. And I will just very gently agitate the area as to properly incorporate the sodium chloride. Good. And moving on to the second step of our treatment, I'm just going to go ahead and apply just a very small amount of this medication. And 1, 2, 3. Perfect. Okay. And just using my finger to slightly warm up the ointment and incorporate it along the section here. And what I'm going to do is just clip off the area. So let's start here. And I'm just going to very loosely place this in a clip. Okay. Let's go ahead and move on to our second section, and I'm just going to very slightly square off our grid pattern here. Perfect. Okay. And here as well. Okay. So again, I am seeing some of that affected area here, and it does appear that it has spread slightly. Okay, so the good news is that it's not as severe as what we were expecting. So I do believe we will go ahead and get you treated today, and you should be okay from there. If for whatever reason the treatment does not work as indicated, we will have you back in about 12 weeks and we can reassess. So at that point, I might send you home with some product that you can apply on about a weekly basis. But for now, I think a one-time treatment will suffice. So just going back in with that ointment and perfect. Okay. Alright, so let's go ahead and create our next section here. Okay. Just going to pin that down for you. Go ahead and apply our treatment here. And once again, just making sure to thoroughly incorporate that ointment. It's very important that it does fully encase the hair follicle. We want it to penetrate the surface of the scalp. Moving on here. Okay. And of course, just applying our product along this perimeter. just ensuring that this is fully incorporated here, and I am going to extend one more section just to make sure. As far as I can tell, it appears that we have treated the affected areas. So let's do one more section just to be safe. Perfect. And of course, applying our ointment to the final affected area. And just applying a little bit more along the perimeter there. Perfect. Okay. Alright, I am going to use my hand and the temperature of my skin to very gently warm the area and just ensure that that product is fully incorporated here so that we are ensuring these affected areas are treated adequately. So what I'm going to do is just brush, or comb rather, the remainder of the product throughout the length of your hair, mainly on this crown area, just ensuring that if there are any more widespread areas here that we can treat them as well. So I would like you to leave this product in your hair overnight, and then in the morning or at whatever point tomorrow you are comfortable, you can go ahead and wash your hair. Now I do recommend a double cleanse because this product is rather sticky and it can be somewhat cumbersome to remove, so just something to keep in mind. It is water soluble, but you will probably have better luck using a double cleanse method. So now that we have treated you, I am going to go ahead and remove the clips, and I will do this in the opposite order. So starting on the side that we first treated. And just brushing through any excess ointment as we go on. Alright, you are doing so well, Isabel. We are almost done with your scalp exam. And in just a short while, we will be proceeding with your back examination. So just sit tight for me as I finalize these last few areas here. Okay, so we have completed the treatment of your scalp, and at this point I would like to allow the ointment to go ahead and further penetrate the surface of your scalp, and we can go ahead and move on to our back examination. So just allow me to change my gloves, wash my hands, and then we will go ahead and proceed. While I'm doing that, I would like you to remove your top and any undergarments you have on your upper body so that I have full access of your back, okay? Okay. All right, I will give you about 5 minutes, okay? Perfect. All right, Isabel, it looks like we're ready to start your back examination. So I will go ahead and place on my fresh gloves and we can get started. Now, this is essentially just double checking that any of the symptoms you have on your scalp you are not experiencing on your back. So somewhat of a brief examination here, just ensuring that everything is on the up and up. So of course I have a couple tools here that I will be using to perform my examination. So I'll just start by having a very brief look with my pen light here and just getting a little bit closer to you as to ensure a proper look. So right off the bat I am noticing a few moles on your back. So something to have a brief look at here, of course unrelated to today's visit, but always a good idea to ensure that is all normal. So this one here is round and symmetrical in shape. It's slightly raised from the surface of the skin, but it is normal in color. I'm not seeing any blackening along the edges or any signs of asymmetry there, so that's okay. And moving on to this more prominent one here. So this one is darker in color, somewhat concerning, although it is round and fairly symmetrical in shape. I would actually classify that more as oval. It is not raised from the surface of the skin, which is a good sign. Okay, so just having a look at the overall texture of the skin itself. Looking for any more obvious abnormalities here. A couple other moles on that side, and they also appear to be within normal limits. Now, I would recommend that you do follow up with your dermatologist at least on a yearly level, so annually, just to ensure that there are no changes specifically because they're on your back. So it might be harder for you to visualize any changes that could occur. So I always encourage my patients to see a dermatologist regularly, and we can refer you to one up at the front desk if you'd like on your way out. Okay. Having a look at your tattoo, it does appear to have healed quite some time ago. And that looks great. And then of course, a larger piece here that also appears to have healed and is in great condition. So no concerns with the integrity of that. So that is great. Now, as far as the symptoms you're experiencing on your scalp, I'm not seeing any of that just right off the bat, so that's very good. What I would like to do though is, of course, just take a few measurements for symmetry from one side to the other, and that will just allow me to ensure that there are no signs of dislocation, any wasting of the muscles or the muscular area of your back, as well as any deformation such as scoliosis or any abnormalities in your skeletal structure. So just testing that out on a few areas here, and of course also having a look at your posture as a whole and assessing any possible issues in there, which I'm not seeing so far. And as I place my ruler midline to your spine, I can see that the edges are even bilaterally, which is what we are looking for. And of course, if I place it this way, I can tell that there is a semicircle here. There are not any signs of ridging or any abnormalities along the spine, which is great news. Okay? Alright, so moving on to a different tool. This tool also allows me to measure for symmetry, so I apologize, it is a bit cold to the touch here, but I am just going to do a couple brief measurements of the sides of your back here. So from one side of the spine to the right, and then of course performing the same on the other side. And one more time up higher. Good. And the entirety of the spine. Perfect. Okay. Then I do like to see with the cranium how that compares to the spine, and we are at about 3/4 distance, which is what we like to see there. So great news. Okay. So what I'm going to do now is perform a couple percussions of your back, and to do that I'm going to be using my Reflex Hammer. So just going to be tapping along certain areas of your back and spine, listening for any abnormal sounds, as well as feeling for any abnormal textures or any lesions underneath the surface of the skin, feeling for any lumps or bumps, looking for any bruised areas, anything sore or tender to you. So any of this causes you any pain, please let me know. If at any point it becomes uncomfortable as well, please let me know. That way we can have a little bit of a closer look at that area specifically. So at this point I'm just tapping along the scapula. Good. So now I'm going to tap directly on the spine. Good. Okay. So I did not note any abnormalities there. I am going to go ahead and palpate with my hands. So what that means is I will be using my two fingers here, my index and my ring finger on both hands, to kind of move in a circular motion and essentially manipulate these areas and feel for any abnormalities. So feeling your scapular indentation here. Good. Feeling along the back region of your rib cage. Good. And now I'm going to use my finger and my thumb to feel along the spine. So the outer portion of your spine. And then as I return, I will gently press down on the spine here, feeling for any abnormalities there, which I'm not noting. Now I'm going to move up for just a second, and I'm just going to watch you breathe for a second. So assessing your breathing, looking for the rise and fall of the back upon respiration. So watching as your back rises, noting both sides, looking for any irregularities. Okay, so I'm going to place my hand flat on your back and just feel as you breathe, just feeling for any abnormalities there. Good. So this just allows me to feel kind of the rate of your breath as well as your heart rhythm. Also allows me to hear or so feel any abnormalities in your lungs, such as rattling or any wetness, but I'm not feeling that, so that is great. Perfect. Apologize for the helicopter. It appears we have a light flight coming in, so I suspect they'll be paging me soon, but that's okay. So what we're going to do now is move on to a test for kind of sensory perception. Now this is going to test you for any neurological defect. So what I'm going to do to start is I have two identical brushes here, and these are just surgical sponges. They're very standard, they're very soft, kind of bristly on one side and just a standard sponge on the other. And what I'm going to do is test you for symmetry here. So I'd like you to just relax for me. You don't have to respond. I'm just looking for a neurological reaction, okay? So you're going to feel me place these objects equally on either side of your back and span down across your body, and I'm just looking for a very normal response, okay? So just relax for me. You are doing so well. Perfect. So very strong reaction here. You are doing great. And if I move, great. Okay. Perfect. So let's do one this way. Good. So now switching to the spongier side. Okay, so all of that does appear to be well within normal limits, so that is good news. And moving on, of course, to a secondary portion of that same examination. And what I'm going to do now is just gently roll this tool along the surface of your skin, and this is going to allow me again to test for any neurological abnormalities. So what I'm going to do is move closer to the top of the bed here, and I'd like you to just remain relaxed for me. It is important that we allow your neurological functions to react as they would. So coming rather close to you here, I'm going to just gently touch the surface of your skin with this tool. And this time I'd like you to indicate whether or not you feel it. So at this point, all you have to do is either say yes or nod or whatever indication is comfortable for you, okay? Okay. Good, you feel it? Good. Perfect. Good job. nice there. Good job. Mm-hmm. Good. Okay. So now what I'm going to do is move this down in a linear motion. I'll do it on one side and then repeat the same on the opposite side. I'd like you to indicate to me whether or not it feels the same or different, okay? So here versus here. Does that feel the same? Good. And here versus here. Does that feel the same? Perfect. Now, horizontally here versus here. Does that feel the same? Okay. Now, can you tell me if here, 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 and here all feel the same? Okay. Good. Okay. For the final portion of your examination, I am going to be touching the surface of your skin with a very cold object, and I'd like you to indicate to me whether or not you feel cold or warm. So for this examination, our cold object is going to be a tuning fork, and our warm object is going to be my finger, okay? So to give you an example of that, cold will feel like this, whereas warm will feel like this. Can you tell the difference there? Okay, good. All right, dear, so let's go ahead and proceed. So again, just indicate cold or warm, okay? Cold or warm? Good. Cold or warm? Good. Cold or warm? Perfect, good job. Cold or warm? Good job. Cold or warm? Perfect. Cold or warm? Good. Cold or warm? Good. Cold or warm? Good. Cold or warm? Perfect. And is this cold or warm? Cold or warm? Cold or warm? Cold or warm? Cold. Very good. And is this cold or warm? And is this cold or warm? Both. Very good. Cold or warm? Warm. Cold or warm? Both. Very good. You're doing well. Now, does this get any warmer as we move down your back? So at any point, does this begin to feel warmer than the starting point? No, it feels the same. So as cold as it is up here is as cold as it is down here. Good. As well as here and here. And if I move horizontally, there are no changes. Good. And no changes at any point here. All of this feels the same. As well as with my hands, all of this feels the same. Okay, perfect. Alright, dear. Well, the good news, Isabel, is that we have completed both portions of your examination. So your scalp exam, as stated, we did find a positive indication of there, mostly just confirming the symptoms that you described to me. Now we have treated those affected areas, and just to remind you, I would like you to allow the treatment to remain on your scalp for at least overnight. You can wash your hair tomorrow, double cleanse as directed, and if you feel after 12 weeks that those symptoms persist, at that point I would like you to come back for retreatment, okay? Now as far as your back, I know you said you thought you might have been experiencing some of those same symptoms, but fortunately I do not see any of that. So it does not appear to have spread along any of these other areas, so you should be okay there. Now if you feel like the symptoms persist and you are still feeling it, you are always welcome to come back in and we can retest you, okay? Okay. Alright dear, well I hope you have a wonderful night. I will give you a minute to go ahead and get dressed. Take as long as you like. You're welcome to come back out to the front desk and schedule with a dermatologist, or just obtain a referral to a dermatologist to have a look at those moles on an annual basis if you are interested, okay? Okay. Now unfortunately I do have to run because they have paged me for that lifeline, so I'm needed elsewhere, but you have a wonderful evening and it was a pleasure to meet you, okay?